hope you all are doing great. So today we will be studying about the two important topics that are appetite stimulants and appetite suppressants. So from the name itself we can relate that stimulants are nothing but the drugs that help to increase the appetite, and suppressant will be holding the action of suppressing the appetite. What is the meaning of appetite? So appetite is simply the desire to consume food. Now these stimulants are generally utilized or given to the geriatrics or pediatric patient in order to gain their weight, as in these two stages the person becomes very weak. So the food supplements or appetite stimulants are given in order to maintain their nutrition, to maintain their health. All right. And now what are the causes of decrease in appetite? So certain kind of psychological disorders like stress, depression, anxiety, in these conditions the person either skips food or does not wills for having the food. So in these cases the appetite stimulants are given in order to increase its hunger. Okay, GIT disorders like peptic ulcer, yes, if in case the person is having peptic ulcer due to inflammation, due to gastric acid, or due to due to severe kind of pain of the ulcer, the person may not likely to have the food, because he will again or she will again go through the same pain. So this is one kind of reason. Older age geriatrics, medications like laxatives, chemotherapy drugs, amphetamine, due to decrease in activity level, and in some specific populations like infants or elder patients. That what's geriatric and pediatric. Okay, now what are the supplements to stimulate the appetite? Generally, vitamins, minerals, herbs are given to increase the appetite. Fish oil also stimulates the appetite. If there is zinc deficiency, it will lead to the change in taste of the food. Lifestyle changes. Now what can we do in order to stimulate appetite? There can be regular exercise, intense workout. If there is regular activity or regular exercise, intense workout, the urge to have food and the hunger automatically increases, thereby it stimulates the appetite. By making mealtime more enjoyable, you can make mealtime more enjoyable. How to make mealtime more enjoyable? Like having your favorite foods, having dinners and lunch outside, that way. Do not change the meal schedule, or the eating schedule should not be hindered. Eating less fiber containing food. Now, what are the drugs that are given as a stimulant? So, first is the dronabinol. This is a cannabinoid medication that acts on the cannabinoid receptors in the brain. It helps to decrease nausea and vomiting-like feeling, which increases the appetite in patients of human immunodeficiency virus. Second drug is megestrol, very important drug. This is nothing but a synthetic progesterone. That is, it is showing drug repurposing. It stimulates appetite and is used to treat anorexia. The third drug is oxandrolone. This is again a testosterone derivative which stimulates appetite and helps in weight gain. And these oxandrolone are generally, used by the gym enthusiastic or the person who is indulged in a lot of physical activities. Okay, appetite suppressants, the next topic. Appetite suppressants are nothing but the agents or drug which will automatically decrease the hunger. Okay, these are generally used for the weight reduction. These appetite suppressants are given in order to make the over obese person or obese personalities into a normal healthy physique. Okay, so generally what are given? Fenugreek, methi, right, glucomannan, Gymnea sylvestre, Griffonia simplicifolia. These all are the scientific name. Caralluma fimbriatia. Green tea is usually taken by a lot of gym enthusiasts or the person who has to, reduce her or his weight. But excessive green tea may also lead to severe hepatotoxicity and carcinogenic effects. Conjugated linoleic acid, Garcinia cambogia, and coffee. Yes, caffeine is taken as your pre-workout, yes, pre-workout meal. So that is again a very hazardous and in over quantity or large quantity, as it is, you know, giving you the anti-stimulant effect, or antidepressant effect. So it will just calm the brain, but it will not calm the brain, instead it will just make your brain to work more than often, and due to the it consisting of the important component caffeine, it becomes severe toxic. Then we have mechanism of actions of these appetite suppressants. Yes, you can see. First is your fenugreek, which is a herb. It works by delaying the stomach emptying and delaying fat and carbohydrate absorption. Glucomannan, it works by forming viscous gel, which decreases the absorption of fat and carbohydrate. Its bulk property reduce food intake. Gymnema sylvestera, herb which is capable of reducing sugar craving, that is insulin resistance, and its active compounds help to decrease the absorption of sugar in blood and even block the digestion of fat. Green tea contains caffeine and catechin, which increase the metabolism. Coffee, it delays again the gastric emptying, it burns the fat at a very intense level, it stimulates to produce the appetite hormones. Conjugated linolenic acid, it also similar to coffee, it burns fats, okay, blocks the production of fat and simulate the breakdown of fat. Caralluma fimbrata, it is again a herb which increases the transmission of serotonin in the brain, which decreases the sugar intake and the insulin resistance. Then we have the Griffonia simplicifolia, which is again a plant-based natural herb, okay, of 5-HTP. In brain, 5-HTP is converted into the serotonin, which is nothing but a happy hormone, and which suppresses the appetite. This 5-HTP, in which 5-HTP which is converted into the serotonin, this 5-HTP usually helps in the reduction of weight and decrease intake of carbohydrates. All right. So this is all about the appetite stimulants. Thank you everyone.